This is Jeff Miera, and I will be demonstrating the Shin tape job for MCAA 570. Here we go. Okay, so first thing we want to do is assess where the pain is located for the athlete, and usually we'll find that on the medial side, the inside here of the shin. It should be fairly low on the leg. If it's up higher, more towards the calf region, then we know that might be a different injury. We've located that the pain is in this area here, so that's where we'll be taping. Second thing we want to make sure of is that we have the athlete in the proper positioning. That means knee bent and foot in flexion here, so that we can have a good base for our tape job here. So let's go ahead and get started. Again, the pain is here. First thing we want to do is lay some pre-wrap. That's just for the comfort of the athlete. Really make sure that no tape gets stuck to the skin or the hairs on the skin. When we're pre-wrapping, we want to make sure that we cover the area slightly above and below the where the pain is located. That way we can have full range to tape without causing our athlete any discomfort. So I've got that tape laid, and then now what we're going to start by doing is we're going to apply the tape. This is regular 1.5 inch tape, and we always want to apply laterally to medially so that we are bringing the back of the leg, the calf here up, as opposed to pulling it down. So we're going to start with that. And you want to take a fairly steep angle here because of the way that the leg works. If we don't take a steep enough angle, a lot of times we will cause bubbling or folding of the tape, which is not good. So we always want to make sure that we take a proper angle. That way we avoid the bubbling or folding of the tape. So we'll make sure, just like with our pre-wrap, we want to start a little bit below the pain area, and we'll go also a little bit above the pain area. So we'll kind of more here. Just to make sure that we cover the entire area. Again, the pain is centered in this area, so we want to make sure we go a little bit above and below it. So now that we have that, our next step would be to go to our second layer of support, just to make sure the athlete is supported enough throughout this. Again, taking steep angles to make sure that there's no folding or bubbling of the tape. Again, important, we want to make sure our athlete maintains his foot in the proper position throughout the tape job. Always taping laterally to medial. one more. And then we want to make sure looks good, looks clean, everything is good to go. Want to make sure that the athlete assesses how he feels in the tape job. Go ahead and move, make sure the athlete still has functionality, make sure it feels okay to that athlete and he's getting the support that he needs. So there we go.